Thirdly, we have suppurative arthritis, which follows bacteremia or infection of the joint. 95% of cases are caused by Staphylococcus aureus and Streptococcus pyogenes. Other causes include Enterobacteriaceae, Neisseria gonorrhea, Haemophilus influenza, Salmonella species, Brucella species, Borrelia burgdorferi, and Pasteurella, and it also includes Mycobacterium tuberculosis. Large joints, example the knee, are most commonly affected. Prosthetic joints are at risk of early and late infections. Then we have the clinical features, which include pain, swelling, and reduced movement. In adults, the onset may be insidious. A history of recent urinary infection or salmonellosis may be reported. Cellulitis or specific signs such as gonococcal rash may be found. Septic arthritis must be differentiated from acute rheumatoid arthritis, osteoarthritis, gout, pseudogout, or reactive arthritis. A diagnostic tap will yield cloudy fluid, and gram stain and white blood cell count may suggest infection that can be confirmed by culture or nucleic acid amplification test. Culture for brucellosis should be performed if the history is suggestive. Intravenous antibiotics that are appropriate to the infecting organisms, either isolated or suspected, should be commenced, and oral therapy is continued for up to 6 weeks. Aspiration and irrigation of the joint may be helpful in severe cases as it reduces inflammatory damage. Now we'll talk about viral arthritis. Some viruses are associated with arthritis, for example, parvovirus, rubella, mumps, and hepatitis B. Rubella-related arthritis is more common in females and develops a few days after the rash. Several of the alpha viruses cause severe bone and joint symptoms. Reactive arthritis caused by an immune response to the pathogen can follow recovery. For example, after meningococcal disease or Shigella or chlamydia infection. The latter can be associated with uveitis and is known as Reiter syndrome. In prosthetic joint infections, prosthetic joints may become infected at the time of operation, early presentation, or as a result of hematogenous spread, which is a later presentation. In early presentation, the organisms are formed in the skin, example Streptococcus, epidermidis, and Staphylococcus aureus, including MRSA. Treatment is that with intravenous antibiotics, depending on the susceptibility of the infecting organisms, infection usually results in loss of the prosthesis. Prevention of infection by controlled measures in both the ward and theatre, and antibiotic prophylaxis with an agent active against Staphylococcus aureus is very important. Okay guys, so this was a brief overview of some of the most common bone and joint infections. For more detailed lectures, keep watching sqadia.com.